We're happy to have one of the physicians from out at Troy Regional Medical Center with us today. And this particular program, we're looking forward to finding out who physicians are, their specialty, and what brought them to Troy to give you, our listener, a better opportunity to know the quality of people. And I truly mean the great quality of people we have in the medical profession available to you from Troy Regional Medical Center. Dr. Lester Littlell is with us today, and we're honored from the fact that you are the first physician we're doing the program with. So
nice
welcome with us this afternoon. We're glad to have you. The whole idea, Doctor, is to let the folks know who you are. Now, you've got patients that have known you because you've been here in Troy how long?
3 years.
3 years, but I'm sure there are a lot of folks out there that don't know who you are and your specialty. So let's talk a little bit about that.
All right. I was born in California originally, but grew up in Tennessee. My father was a physician. His 3 brothers were physicians, primary care or general practitioners, they call them. So that's kind of all I knew. I'd planned to go into practice with my father as a primary care physician, but during my training I noticed that had changed a lot. He could do surgery, orthopedics, anything, and I like to fix things, so I became interested in orthopedics. Went to the University of Tennessee Medical School in Memphis and graduated there and finished my residency in orthopedics, University of Tennessee in Chattanooga, and then stayed in Chattanooga and practiced there for 17 years. I have 2 children. They both graduated, if I dare say, from the University of Tennessee at Knoxville.
It's perfectly all right for us in Troy to hear that. What brought you to Troy?
Well, after my kids graduated, I had been interested in field trials most of my life. So I would come to Union Springs every chance I had, ride and watch, and then I ran dogs and had dogs with trainers, and that was my vocation for 25 years. And so once I could finally get away, I moved down to Alabama in 2000, and my daughter is an attorney, Lisa Corson, in Montgomery, so Troy was a perfect fit to be close to my family.
Orthopedics. Let's talk about the need for orthopedics in our area. You've been here long enough now. The whole concept with this interview to begin with is to inform people of the fact that there's no need to travel to Montgomery or to travel to Dothan. We've got specialists here, so let's talk a little bit about your work.
I really have never met an orthopedic surgeon who didn't like what he did. And I think it's because, unlike many specialties, I'm not against other specialists, but people that come to us, usually they're in pain, and we can, most of the time, successfully treat it, so when they leave, they're happy and they're out of pain. We don't just monitor them and adjust their medicines. They come with a specific problem, we recognize it, and hopefully can treat it. I'm speaking specifically of things like total knee replacements, total hip replacements, rotator cuff tears, knee arthroscopy. These are the most common operations I do.
And we can do these right here in Troy.
Yes, I've done hundreds of total hips and knee replacements right here in Troy.
We have those specialists after the operations to do the needed work on the side. Just give me an overall viewpoint, if you will, on how you feel we are set for medicine here in Pike County.
I love Troy and I love the hospital. I used to be in a big city hospital, and we had what they call the next biggest town syndrome, where if you were from a smaller town, you thought you need to go to a bigger place to get better care. You don't know where you are when you're in an operating room. You could be at Mayo Clinic or you could be in Troy, Alabama. It's all the same. People don't understand that. The other thing that I think is interesting is that doctors that are board certified, all trained at the same places. The only thing that's different is some just like to live in cities, and some doctors like to live out in the country.
It would be good to check on the specialties that you have here in Troy. Over the years, Troy Regional Medical Center has evolved. We have other members of the physician community will be coming on in the next days to come. And our idea, as I had said before, is to inform the people of who we have, their qualifications, and look toward Troy Regional Medical Center for their advanced medical needs. I think we're very fortunate to have you and your expertise here. Thank you.
Thank you very much.
This broadcast brought your way by Troy Regional Medical Center.